So take us back into what you believe are the causes and how this thing comes, why there's so much of it these days.
Really, what we consider these focus and attention issues are due to a strong contribution from what we believe to be too long a use of folic acid in pregnancy. Folic acid is really necessary for the first trimester of pregnancy. So please understand, we're not saying don't use folic acid. That would be a big mistake. You need folic acid to make sure that what we call neural tube defects don't happen. That's a problem where the brain doesn't develop properly. You need to do that for at least the first trimester. So you take your folic acid when you're getting pregnant or looking to get pregnant, and then you take it throughout the first trimester of pregnancy. So you know for sure you're pregnant, take it for an additional 3 to 4 months, and then you're good. The problem is when you take it far longer than that, that can actually be one of the factors that can predispose your child to having ADHD.
That is interesting. That is really, really interesting. And you have data and research for this, Doc?
Oh, absolutely. Absolutely. We see a very strong correlation. If you can even do this one yourself. You look at the rate of increase of ADHD and autism for that matter, and the timing of when we started suggesting that our mothers, pregnant mothers, take folic acid beyond the first trimester. You'll see the slopes matching up perfectly in the research. See the slopes perfectly, perfect increased correlation between the two. And we also know empirically that most of the children who have ADHD are what we call undermethylated. Methyl molecules being regulating switches, if you will, and there are not enough of them. And folic acid actually removes more of these switches from your system and the level of DNA. Okay, that's where it counts. And that's what excessive folic acid does. And we see that all these children are low in these switches. So we can draw 50,000 different correlations, but the fact is they're coming up with the same points. Folic acid is key, timing is key, and excess usage is key.